Today, we reached a milestone. It has been 100 days since Governor DeWine's stay-at-home order.
Senior health correspondent Monica Robbins made history that day, anchoring our first full newscast from her home. And she takes a look back at everything that's happened since.
We are now both obviously coming to you live from our homes because we are in that effort to follow those guidelines. And the information about COVID-19 is constantly changing.
And so it began, a new way of life for all of us, an uncertain future. The pandemic became real 100 days ago when Governor DeWine took the historic step of shutting down the state. That day, we had 442 COVID-19 cases and 6 deaths.
This is a high-risk operation, but it would be high risk if we didn't do anything.
DeWine, Ohio Department of Health Director Dr. Amy Acton, and interpreter Marla Berkowitz became household names as we tuned in for their daily coronavirus updates. Remember Wine with DeWine and Snackin' with Acton?
Stay home. Stay home. How's about we coordinate it?
Even a parody cartoon. Those early days had people desperate for testing, too many for hospital drive-thrus, and not enough tests.
We have basically shut down drive-thru testing.
Those lines were nothing compared to lines at food banks, and millions filing for unemployment, or at least trying to, as Ohio tried to manage record claims. Happy birthday. Our elderly, the most vulnerable of all, were kept inside. We visited as best we could through windows or phones. Still, too many died. At home, we learned to cope. Some took to making masks, while others scoffed the science. Toilet paper became the gold standard as grocery stores remained open with major changes. Parents became teachers as our schools remained closed.
Salt and pepper on the chicken.
In April, we passed 10,000 cases and 100 deaths. Little did we know that COVID-19 was just getting started. For some, their patience was near an end. COVID and quarantine fatigue became a kind of secondary infection. By May, Dr. Acton became the target of protests at the Capitol, even her home, as some argued for an end to the orders. That month started with 1,000 deaths. It ended with 2,000, yet we pressed on, finding new ways to celebrate birthdays and graduations. Drive-bys took on a new, more pleasant meaning. In mid-May, as the virus seemed to slow, we began to peek outside our homes as businesses slowly reopened. By month's end, another health emergency brought our nation to its knees: racism and the death of George Floyd. In June, COVID-19 took a backseat to the racial unrest affecting us all. The virus never stopped as we passed 2,500 deaths and 50,000 cases. Today, 100 days after that historic order, we're once again at a place for major decisions, solutions to stem a new surge from a relentless virus.
And Laura, you started with us in the middle of all this, and I'm still working from home since March 23rd. I haven't even had a chance to personally meet you yet.
Which is so crazy. You know, I know we've exchanged emails, but I have to tell you, when I started here, like you said, during COVID, during the pandemic, I was a viewer first, and I watched you, and you brought such comfort. You brought the important information to us. So I thank you for that. And yes, I look forward to meeting you, hopefully sooner rather than later, Monica. I also have to ask you a question, though, about one of the biggest issues, I guess, is wearing a mask. I guess I know, but some of us still aren't sure what type of masks give us the best protection. Anything you have to say about that?
Yeah, Laura, there was actually a recent study done regarding material in masks, but in simplest terms, here's what I can tell you. The mask should cover your nose and mouth with no gaps and have thicker material, meaning you can't see through it. So a bandana or a gaiter, probably not the best option. Go for surgical masks that are now pretty much available in stores, or if you make something, just make sure it's tightly fitted and pretty and pretty thick. And back to that study, here's how it worked. They put a mask on a mannequin that could cough and sneeze, and they checked the droplet barrier. Here's what they found. Without a mask, the droplets traveled more than 8 feet. With a bandana, they traveled 3 feet 7 inches. With a folding cotton handkerchief, they traveled 1 foot 3 inches. With a cone-style mask, what you might wear in a hospital or a construction site, they traveled about 8 inches. And with a stitched Quilton cotton mask, it was only 2.5 inches. So those homemade masks can actually work really well if they're made correctly. And medical experts say if we want to fight this virus, masks are the best way to do it right now.
Wearing a mask is normal behavior under our current circumstances. And people shouldn't think it is any more an infringement upon the rights as saying you can't drive drunk. You can't drive drunk because you're a danger to other people. You should wear a mask so we're not a danger to each other. To me, it's no different. And there's rules in society. You can't go into a restaurant with no shirt on. And you know, wearing a mask during the pandemic should be seen like that.
It's pretty sobering to compare it to drunk driving. I consider it like wearing a seatbelt to protect yourself and others, and I understand it's hot out. You don't need a mask when you're alone or if you're at home, unless, of course, someone in your house is infected, but you do need one in public places whenever you're around strangers and you can't keep at least 6 feet apart. Also, with this recent increase in cases, I would not be surprised to see the governor make a mask mandate. Pennsylvania just did, and especially in areas with high cases such as Cuyahoga County, Laura.
Lots of great information. Monica, thank you.